Okay, hi everyone, and salam sejahtera. So thank you very much for joining us today in YSN-ASM Science Cafe Penang. So the topic for today's session is Kids Are Not Mini Adults, Pharmacists Explain. So here we have two registered pharmacists, Dr. Hadzliana Zainal and Dr. Nur Aizati Athirah Daud. So both are lecturers in School of Pharmaceutical Sciences and also affiliate of YSN-ASM. And it will be a dual language session, so the communication will be in English as well as in Bahasa. So there are two housekeeping announcements from me. So please post your questions in the comment box and feel free to post the questions in Bahasa. And then also please attempt the questionnaire which will be given at the end of the sessions because we need your feedback. Okay, without further ado, I pass the session to Dr. Hadzliana and Dr. Seti.
Thank you very much, Dr. Tiger, for the kind introduction. It is a pleasure for me to be here with Science Cafe. My name is Dr. Zeti, and today I'm accompanied by Dr. Liana, my colleague in School of Pharmaceutical Sciences, USM. So today we're going to discuss on why kids are not mini adults when we talk about medication use. Ini adalah diskusi dua bahasa, santai, bilingual. Jadi anda boleh kemukakan soalan dalam bahasa Inggeris ataupun bahasa Melayu. So before we move on further into the discussion, maybe Liana, you can share with us what do you mean by kids are not mini adults? Silakan.
Okay, thank you Tiger and Zeti for the introduction. Okay, historically, children were originally treated as small adults. So for example, the dose are scaled down per linear weight, okay, leading to potentially either overdosing or less dosing in small children, especially the neonates, as their kidneys and their liver are not yet fully developed to process the medication that they have in the body. So as time goes by, many researchers have tailored the drug development and dosing recommendation based on the organ function maturity and also weight-based or surface area-based dosing. Okay, these information are basically made known to the healthcare providers as they learn in the university or throughout their job. Okay. However, for parents, they may not know this information. Hence, today, we will discuss on the basics of medication dosing for children. Let us start off with the pediatric classification first. So we have neonate from 0 to 28 days. So neonate, we have two more terms. Okay, we have term and preterm. Okay, so term would be those delivered 37 weeks and above, and also preterm before 37 weeks. And then you have infant from 28 days to 12 months, a year, and then toddler from 1 and up to 2 years. And then you have preschool child, you have school age child, and adolescent. Okay. So let's move on to the routes of administration. So for routes of administration, there are several. Okay, you may not have heard all of them, which is good, meaning that you are not ill. Okay, so we have buccal, which means the medication is put between the gum and the cheek. Okay, we have oral, the normal tablet, syrup, capsules. Okay, pulmonary, those medication that is given straight to the lung, like an inhaler. And you have transdermal, which is skin. Okay, and then you have ocular, through the eye, like eye drops. Okay, and then you have nasal, you have through the nose, where like allergic rhinitis, where they are given spray for the nose. Also you have sublingual, where you put under your tongue, and also vaginal or anal, like the suppository that you put into the either the vaginal or anus. And also you also have otic, okay, through the ears as well. And we know parenteral as injection. Okay, there are several. We have intravenous through the blood vein, through the blood vessels. Okay, and then we have intramuscular, like your flu shot, okay, where you get your shots in the buttock or the arm, right? And also subcutaneous, okay, between the skin and the muscle. Okay, so whatever it is, it depends on the needs of the patient. So these routes of administration is not just this, okay? There are many more which we are not going to dwell into today, right? So just a term, okay, that we're going to learn today, which is pharmacokinetic, okay? What the body does to the drug. So you might unknowingly seen this word actually. If you are curious enough, okay, if you see this kind of leaflet in the medication box, okay, you will find that there will be a word here called pharmacokinetics. Okay, so you will see that each drug company will have to do a pharmacokinetic study to learn about the medication, what happens in the body. Okay, so there are 4 things that you need to know, which is absorption, okay, ADME. So absorption, how the medication moves from the site of administration to the bloodstream. And then you have the D, distribution, the journey of the medication, okay, to the target site of the action. And then you have the metabolism, how the body changes, okay, the medication to become inactive. And then you have the E, the excretion or the elimination, how the body removes the medication through urine or feces. So basically, medication, they do not stay, okay, they will be absorbed, brought to other places in the body, site of action, and then finally being excreted. So there are several development factors in children that will lead to certain implications. So I'll give you some illustration of it. Okay, for example, absorption. Okay, in neonates, for example, the stomach emptying time is rather prolonged relative to the adult. So when the drug moves into oral drugs moves into the gastric compartment, the stomach, it will need to move to the small intestine where the largest absorption happens. But if the gastric emptying time into the small intestine is delayed, okay, so there will be delayed absorption. So the implication would be there is a need to find an alternative route than the oral route. For example, another example, infants have larger surface area to volume ratio and thinner skin layer. So for those topical medication, there will be high risk of toxicity, okay, via skin absorption. So you may need to reduce the dose. Okay, what about distribution? Okay, so infants have a higher percentage of extracellular water and body fat. So that's why you see they are all puffy and cute, okay? So because they have a lot of extracellular water and fat. Thus, this will lead to higher volume of distribution. So volume of distribution will be the volume of drug, the amount of drug that goes to the other parts of the body. So the more the water and the fat, okay, the higher dose that you need to get the same effect as a normal adult or a normal circumstances, okay? So infants have lower concentrations of circulating plasma protein, reducing protein binding. So in the blood, there will be protein called the albumin, whereby the medication will be stuck onto the protein, okay? So if there is less protein, then this is only for certain drugs, yeah? Okay, so for certain drugs with high affinity, okay, they bind hard to the albumin, they will have problem binding, so there will be free drug. So this free drug is going to give rise to unwanted effects. These are unwanted effects, okay, like we call it toxicity. Okay, so when there is a reduced protein binding, so that there will be a need to change the dose, for example. Okay. So what are the differences with adult dosing? After looking at all these factors that's happening in the during development of the children, okay, so we need to ensure that they are weight-based dosing. Okay, so they are weight-based dosing as compared to adult. They probably have smaller doses of or smaller total dose. Okay, different route of administration or types of medication, more accurate dosing needed, and different frequency or longer duration needed. So that's about the introduction for the for today's topic. Zati?
Okay, Liana. it's interesting to know that children react differently to medication as compared to adult, right? Although anak kita mungkin ikut sebiji perangai kita, tapi tak semestinya
Oh,
reaction
sangat.
kepada medication sama kan?
Sama.
Okay. I have a scenario for you, Liana. A man came to the pharmacy. He was looking for a syrup paracetamol, contohnya, for his child aged dalam lebih kurang 5 years old. And he said that his child is having a fever. So can you share with us how would you determine the dose that the child needs for that syrup paracetamol?
Okay, all right. So syrup paracetamol, as we know, syrup paracetamol is also sometimes, you know, people are well versed with the brand name Panadol, okay, but paracetamol has other names as well, okay. So everyone will definitely get paracetamol sometime in their life, okay. But for children, it's very common because they get fever, right? And paracetamol is considered safe in the children when given the correct dose. So for example, paracetamol dosing, okay, the recommended dose for children is 10 to 15 milligrams per kg of body weight. So for example, if the weight of the children is 10 kg, so the dose should be between 100 to 150 milligrams. So that's simple mathematics, 10 kg times 10 or 10 kg times 15 milligrams. So this dose can be given every 4 to 6 hours and maximum of 4 times a day, not too many times, okay? If you do that, then there will be a problem with toxicity, okay? So please take note of the strength of the medication. Okay, in paracetamol has 2 strength, okay, we have 250 over 5 ml and you have 120 milligram over 5 mils, for example, okay? So calculation wise, if you take the 250 milligram per 5 ml, you will only need 2 mils of liquid, okay, if you need 100 milligram of dose. Whereas if 120 milligram per mil strength, okay, kekuatan dia tu, then you will need 4.2 mils. Okay, so what is the implication? So contohnya ada anak yang so selama ni beli 250 mg per 5 mil dan kita bagi anak kita 2 mil, okay, tapi tanpa kita sedar kita dapat paracetamol yang 120 mg per 5 mil. Kita bagi juga anak 2 mil. Jadi dia akan dapat dos yang kurang. Kalau kita terbalikkan, okay, kita dah biasa dengan 120 mg per mil, tiba-tiba kita dapat 250 mg per 5 mil. Okay, maknanya selama ni kita bagi 4.2 mil, okay, kita bagi juga 4.2 mil. Maknanya anak tersebut akan dapat dos yang berlebihan. Okay, jadi perkara ini sangat penting untuk ibu bapa tahu tentang kekuatan sesuatu ubat tu. Okay.
Alright, what is the difference it is between 250 milligram dengan 120 milligram kan?
Yeah.
It's like double kan? Double.
Yes.
So it's very important for the parents to know to look for the strength of the preparation. Okay, now kita ada that paracetamol syrup kan? How long can we store that syrup? Adakah ke titisan terakhir ke ataupun tak boleh sebulan ke 2 bulan ke macam mana?
Okay, so unopened bottles, okay, can follow the expiry date. Okay, otherwise for open bottles, about 6 months for syrup, okay, from the date of opening. So 6 months from the date of opening. And then you should also take note that for antibiotics, okay, water is added to the powdered medication. So it loses stability with time. And you shouldn't be keeping the medication anyway. So you should be discarded after you have finished the antibiotic course, if there's any left over. So you can find the date from the bottle, okay, which states, for example, expiry date or EXP date or EXP, used by, used before. Okay, so these are all the same meaning, okay, the terms that they use. So if it says May 2020, for example, then it will be 31st May 2020, okay, the expiry. So what will be the implication of keeping beyond expiry? Okay, the problem is that the active ingredient could become chemically unstable, right? The effectiveness of the drug is unknown and could become harmful, and the risk of contamination because you open and close many times. So there will be a risk of contamination.
Alright, walaupun walaupun dah expired tapi banyak lagi, jangan sayang kena buang ya.
Ya, betul.
Okay.
Setuju.
So I have one frequently asked question. Maybe you can answer. Sometimes my child was given a paracetamol tablet which should be inserted via anus instead of mouth. So how is that different from the syrup form?
Okay, simple enough. That is called a suppository. Okay, where it looks like a bullet where you can administer into your bottom. Right? Because if it is made of cocoa butter, okay, from cocoa beans, so it holds at room temperature but dissolves rather quickly. Okay, when it comes into contact with body temperature, so it's like melts in your mouth. Melts in your body, not in your mouth. Okay, it gives more rapid absorption for immediate relief of fever. So it's very convenient to use, especially when you need to use it at night for kids. Less struggle, less drama, less screaming, okay, as compared to waking them up to take their medication. But only a handful of medication are available as suppository, and one of it is paracetamol.
Yeah, it's very convenient. Kalau anak kita demam kan, dia tengah lemah tu, kita boleh just masukkan that suppository. Tapi I think we need to dip in the water first so that it can glide smoothly, kan?
Betul, yeah. So, okay, enough about my talk. Okay, Zeti, it's your turn now. Okay, there's a myth saying that we do not need syringes to measure dose for kids. Okay, we can use teaspoon, tablespoon, our parents have been doing that when we were young anyway. Okay, so what do you think about this?
Okay, definitely a myth, Liana. We cannot use a tablet ataupun teaspoon ataupun tablespoon. And I have evidences here. I bawa my 2 type of spoon from my house. And can you see the difference between these 2 spoons?
They are all both tablespoon, right?
Both tablespoon actually, yeah.
Okay.
Macam mana ni? Yeah, this.
Yeah. Dia kena buat macam makeup tu kot. Letak tangan gitu kan. Oh, nampak.
I tak biasa macam tu. This one is actually more concave, lebih cengkong daripada this one.
Yes.
Do you think the dose that we're going to give to our child is going to be the same kalau kita pakai these two? Kan?
Yeah.
Let's think about that for a bit. And we also have another measuring cup. So this is the measuring cup. Usually it comes with the bottle of your preparation lah. Ubat lah, this one paracetamol. And we also have another one. Ta-da! This is my favorite syringe. Okay. Between these 3 measurement tool, which one do you think is the best? Tiger,
your favorite.
Oh, my favorite. Tiger, can you please?
Because you given the answer, your favorite.
Oh, okay. Because I'm a pharmacist, my favorite would be the best lah. Macam tu. We actually have a study in India. They give parents around 400, nearly 400 of them. They got to choose between these 3 measurement tools to give 5 ml of syrup paracetamol to their child. And majority of them choose this measuring cup. And some of them choose the syringe, but also 8% of the participants choose the tablespoon. Okay, and then they measure back the amount that they took from the syrup, and then they found that those who use this measuring cup, about 19% had committed some medical error. I mean the dosing is a bit different, lari sikit lah daripada that 5 ml tu yang sepatutnya kita bagi. And those who choose the syringe tu yang paling sikit buat error. Dan of course lah kita tahulah this is the worst selection. The tablespoon is the worst selection. Okay, so now we know kan, this is my favorite. Should be your favorite too. And If you're a parent of children less than 10 years old, I think better keep beberapa sebagai simpanan lah. Nanti in case of emergency, you can use the syringe. And also
beberapa ni juga kan, beberapa volume kan, ada yang 5.
This one is 5, ada juga 10. Paling kecil ya 3 I think. And I have a tip for you guys. You mentioned about the risk of contamination because we keep opening the same bottle, right? So we can use this one sebagai this measuring cup. Before we take using the syringe, we pour out a bit in this measuring cup. Kalau contohnya that dose tadi 4.2, you put dalam 5 ke ikut measurement kat sini. And then baru you take pakai syringe 4.2. And then the rest you buang lah sebab yang ni takut ada risk contamination because you masukkan syringe kan.
Okay. Jangan tuang balik Jangan tuang balik.
Jangan tuang balik.
Okay.
Tak payahlah sayang, just very a few mil tu tak apalah. Sebab kalau kita masukkan di syringe dalam botol ni beberapa kali takut ada contamination. Okay. Alright.
Nice to know. Okay. So as we were talking about paracetamol, can paracetamol syrup be used for another child? Like we have 2 children, so can it be used for the second child, for example?
Yes, you can, provided it is the same medication that the other child needs. Contohnya dua-dua demam, ubat tu ubat kakak punya, adik pun demam juga, kita boleh bagi. Provided ada 2 condition sini. First, you have to check for the expiry date. Contohnya kakak tu demam bulan lepas, adiknya demam bulan ni. So you have to check for the expiry date. Adakah tak expired lagi? Kalau tak expired boleh guna, jangan bazir. Second one is you have to know the dose that you need to give to the adik tu lah. Kena kira balik. So jangan pakai dose yang sama macam kakak. So kena kira balik macam calculation tadi lah.
Okay. So tak payah ibu bapa tak payah susah-susah risau tentang macam mana nak kira paracetamol tadi. Actually paracetamol calculator is available online. Okay, you just Google paracetamol calculator, masukkan berat badan anak dan juga strength, kekuatan. Sebab tu kita kena make sure ada tahu kekuatan tu. Jadi calculator tu akan bagi berapa mil yang anak tu perlu ambil
Bagus. So now Liana, I have a tricky question for you. So how do you manage the child that doesn't like at all medication? Macam ni. Setiap kali nak bagi ubat macam ni. Macam mana tu? Do you have any tricks?
Guling-guling, lari-lari. Okay. Alright. So if you can show my slide again. Okay, so there are some tips and tricks that you can adopt, to administer medication for kids. Right, so we even if you look up on the net, you can have like hacks for parents, things like that. Okay, so ask the pharmacist for flavored syrup. Usually there will be flavored syrup, and ask your child what is the favorite flavor. Okay, it can come in orange, it can come in strawberry. Okay, choose what they prefer. Okay, as you can see, also remember, shake before use. Okay? And as you can see here, these are some of the pictures I got from the internet actually. Okay, this one, the first one, the mom put in the favorite juice box. Okay, and then the bottom will be for babies. Okay, just put the puting tu. Okay, dengan syringe, letak syringe dalam puting tu, so baby ingat dia minum susu. And the best part, the next one, the bigger picture here, dia ingat dia minum Pepsi, kesian kat dia. Okay, actually ada ubat dekat belakang Pepsi itulah. These are creative moms. Okay, and about syringe tadi, let them play. Okay, satu lagi, jangan takut-takutkan dia. Okay, we like to say, nanti masuk, nanti main lama-lama dekat luar nanti sakit. Sakit nanti kena makan ubat. So you takutkan dia dah at the very beginning. So they don't want, so they think that ubat is something that they should not be taking. So bagi dia orang main syringe tu, okay, you have one, I have one. Okay, main dengan air dulu. Okay, sambil-sambil main tu, bagi dia ubat tu. Okay. Tapi kalau budak kecil, okay, infant, best to sit upright, okay, masukkan dekat tepi cheek dia biar dia mengalir. Okay, sebab kalau kita squirt direct dekat tekak, takut dia tercekik, choking, okay. Nanti muntah pula. Tu satu hal pula nak bagi ubat tu kan. Lepas tu kita boleh bagi upah lah. Okay, dia orang dah berjaya makan, bagilah upah sikit. Yogurt ke, aiskrim ke, macam tu. Ataupun kalau dia tengah ralik-ralik main tu, tengah makan, bagi dos sikit. Cumanya prevent large dilution. Okay, jangan bagi dalam susu contohnya. Sebabnya kita tak tahu susu tu kalau dia decide, okay saya dah kenyang, saya tak nak habiskan susu tu, dia letak susu tu ke tepi. Padahal ubat tu masih ada lagi dalam susu tu. Okay, so bila tak habis, dosnya tak cukup. Okay. So cuba kalau perlu untuk campurkan dengan sedikit benda yang lebih manis contohnya, kuantiti tu biar sedikit supaya dia makan semuanya. Okay, as a summary of apa yang saya dah present semua ni kan sebelum ni. Okay, pediatric growth and development occur throughout childhood. So we need to understand what is happening in our children. Okay, and then when dosing for children, it's appropriate to refer your pharmacist or your doctor. Okay, and as many doses are given milligram per kilogram. So take note of your children's weight, and for children who are taking long term, okay, budak-budak yang sakit kronik, okay, kita perlu pastikan berat badan dipantau selalu sebab dos akan berubah. Okay, right? Yep, Zati.
Yeah,
okay.
That's really nice trick and tips there. Tapi definitely not going to use that one with the Pepsi bottle, tak adalah.
Kesian dia kan?
Itu confuse lah.
Alright, Zati, we hear a lot about antibiotic resistance kan in the mass media. So people would definitely ask, will it affect my child? What do you think about this?
Yeah, usually even bukan our child pun, even kita pun, kalau doktor bagi or prescribe us with antibiotic, mesti pharmacist akan cakap kena habiskan kan, kena make sure kena habiskan. So it relates to antibiotic resistance lah. So first kita kena tahu apa maksud dia antibiotic resistance ataupun kerintangan antibiotik. So does it mean that our body is becoming resistant to antibiotics? Adakah badan kita yang resistant dekat antibiotik yang kita dapat tu, ataupun does that mean that the bacteria has become resistant to the antibiotics that are meant to kill them? So yang mana satu, badan kita ke bakteria tu yang resistant? Okay, Hadzliana nak jawab ke? So it's actually the second one, the bacteria tu yang resistant. So for example, kita ada kat sini Staphylococcus aureus, ni dia culprit lah, penjahat ni. Kalau dia invade, it can cause infection to our body, and then kita fight dia dengan ampicillin. Ampicillin is one of the type of antibiotic, and then suddenly this Staph aureus ni dia bijak sikit lah, so dia tahu dah ada senjata ampicillin tu, so dia tukar strategi, so dia adapt, dia mutate, so that they become a new strain of Staphylococcus aureus. So sekarang dia jadi ampicillin resistant Staphylococcus aureus. So sekarang dia dah resist lah dah resist dengan ampicillin tu tadi. So ampicillin datang, dia macam okay, tak mati pun. Okay, and then so now scientists dah tahu, okay, now we have a strain of resistant Staph aureus to ampicillin. So now we give vancomycin. And then okay lah, ada separuh yang mati lah. Tapi some strain tu, they can develop another adaptation. So dia kata, oh okay, senjata lain, alright. Kita ubah lagi strategi kita, adapt lagi, mutate lagi. So now they become a superbug, vancomycin resistant Staphylococcus aureus. So macam licik tak dia? The bugs can be very licik lah. It can adapt and mutate until it become a super bug. Dan dia memang satu masalah global dan even ada setengah bakteria tu yang sampai sekarang the superbug ni lah, sampai sekarang kita tak jumpa lagi antibiotik yang boleh lawan dia. Okay? Yeah.
Okay. Macam apa? Kita dah cakap dah, okay, finish antibiotic. Saya selalu dengar, okay, doktor cakap, pharmacist cakap. Tapi apa reason behind this actually?
Okay. So we go back to this diagram. So let's say kalau, okay lah, kita dapat infection Staphylococcus aureus tadi kan. And then doktor first time dia bagi ampicillin. So macam sepatutnya ampicillin diberi for example 7 days kan. So doktor kata okay, completekan 7 days of this regime. Tapi kita makan, okay, day 1 makanlah, day 2 makanlah. Lepas tu day 3 tu dah rasa sihat lah. Macam okay, dah tak ada demam, dah tak ada simptom semua. Okay lah kan, macam tu dah boleh stop lah kan ubat kan. Itu macam
typical.
Stop ubat. And then kita dah tak ambil. The 3rd day sampai 7th day kita tak ambil. So apa yang jadi ialah sebenarnya hanya separuh daripada battalion Staphylococcus aureus ni telah mati. So ada lagi backup kat belakang. So backup yang kat belakang ni dia nampak member dia dah mati sebelum tu. Kan dia dah nampak senjata tu macam mana kan. Dia dah nampak dah strategi ampicillin tu macam mana. So dia adapt. So waktu itulah dia adapt. And then they become resistant. So next time bila kita sakit balik, dah rasa simptom tu datang balik on the seminggu selepas tu, mungkin kita dapat this resistant punya type, in which kalau doktor bagi lagi ampicillin the second time it won't work. So kita tak akan sihat lah. It won't kill the strain.
So yang penting kita dah tahu dah kan the duration yang perlu kita makan tu kena habiskan lah kat mana-mana tak?
Ya, and satu lagi sebenarnya jangan duk gaduh nak pergi minta antibiotik daripada doktor, because usually kalau kita rasa the normal cough and cold kan, sesama biasa, rasa macam flu, sore throat tu kemungkinan besar ia disebabkan oleh virus. So kebanyakan daripada case yang common cold ni disebabkan oleh virus. Kalau virus infection, kalau kita bagi antibiotik pun tak akan berkesan juga because it's caused by virus. So mungkin kita kena tunggu dulu. Biasanya viral infection ni akan resolve dengan sendirinya, dengan badan kita ada immunity sendiri, so dia akan resolve. Unless kalau demam tu berpanjangan, simptom tu berpanjangan 3-4 hari, mungkin dah infected dengan bakteria. Mungkin pada waktu tu kita pergi jumpa doktor untuk dapatkan nasihat lanjut.
Okay.
Yeah.
Alright. So okay, kalau ada anak yang ada simptom yang sama, okay, so we have children who have the same symptom as the brother, okay, can we share, okay, that's a myth, right? So can we share antibiotics with others who have the same symptom with us?
Unfortunately, we cannot unless we get the proper diagnosis from the doctor. So mungkin kita akan dapat the same symptom dengan orang lain, tapi maybe the type of bacteria is not the same. So we have to get a proper diagnosis from the doctor. And another thing is one preparation ataupun if we get that one bottle for our child, and then tiba-tiba the second child also get the same symptom and the first child got this antibiotic, tak boleh nak share lah because the antibiotic is actually dah calculated for that first child and memang dia kena habiskan. So kalau kita nak share dengan the other child pun nanti tak cukup lah the first child punya dose kan. So
kalau diagnosis sama lah kan.
So apapun get a proper diagnosis when it comes to infection.
Okay. So bila cakap pasal medication, parents are usually afraid of the side effects of the medication. So is it true that children get serious side effects? And if it's true, is it serious enough to be afraid of giving them medication?
Okay, Liana. All medications actually can cause side effects. Also for us, kalau kita ambil medication, we also have the risk to get at certain point side effects ke ataupun a serious side effect ke, we just have to keep that in mind. So any medication that we took, we always have the possibility to get that side effect because we are taking something foreign to the body. However, each medication that are available in the market, they have been tested for the safety and efficacy. So before they are being marketed, they will undergone a series of clinical trials in which they are being tested in terms of the efficacy, what are the doses that are appropriate to be given, what are the safety level, the toxicity effects, everything has been laid out in the product leaflet that you have shown before, kan? But note that these side effects may not occur to everyone. So only some percentage of people have this side effect. It also depends on our genetic as well, on how our body would respond to the medication. And maybe Tiger, maybe I can have the slide. And when we talk about side effects of medication in children, it can either be expected or unexpected. If it's an expected effect, it means that the scientists have already studied that it is a known effect that is related to the drug action in the body. Whereas the second one, which is unexpected, so this is more like something that is totally we cannot expect from the drug action itself, and usually it's called drug allergy. Contohnya macam kita ambil paracetamol, we have rash kan, itu macam sangat jarang orang dapat rash because of paracetamol, but if we have that, we are allergic to paracetamol. So in this case, you have to be aware of which medication that you are allergic on, ataupun any our children have any allergy of medication ataupun allergy kepada makanan, we have to take note, and every time kita nak dapatkan ubat, kita kena bagi tahu pharmacist ataupun doktor lah. And in terms of the children punya risk, many medications that are used in children are off-label. So off-label ni maksudnya digunakan tanpa indikasi yang jelas di dalam produk leaflet tadi tu. Sebab biasanya setiap ubat dia ada indikasi dia masing-masing, tapi untuk children, mereka tidak masuk dalam kajian klinikal tu. They are not included in the clinical trial. So that's why it cannot be clear cut that this indication this drug can be used for children. Tapi biasanya untuk disease yang tak ada option lain, kita boleh pakai the same ubat macam adult. So kita panggil sebagai off-label use. So some of the example of the side effect yang kita tengok, mungkin beta-lactam antibiotik macam penicillin, ataupun ubat untuk sawan, seizure medication, dia boleh menyebabkan skin eruption. Skin eruption tu macam keluar rash, keluar yang biji-biji merah. So this mungkin boleh ke seluruh badan jugalah. Okay. And satu lagi tetracycline, ini spesifik untuk babies bawah umur 1 tahun. Kalau babies diberikan tetracycline, dia boleh menyebabkan pembantutan perkembangan gigi, dan kerana tetracycline ni dia boleh kilit dengan kalsium, dan budak kan tengah membesar, dia tengah nak keluar gigi, nanti mungkin gigi tu akan jadi kuning dan dia permanent. So mungkin boleh take note on some of that. Tapi if you get a proper consultation from pharmacist ataupun doktor, of course diorang akan tahu and advise accordingly.
I see. Okay, good to know about the side effect. So tak perlu risau lah kan, sebab bukan semua orang kena pun, and usually it's very mild, like sometimes just nausea. Okay, kalau kita belajar kan, kalau side effect je nausea, vomiting. Okay.
Jawab macam tu je.
Nausea, vomiting, and it's also curable. Okay, bukan something yang permanent pun. Right? Okay. So kita cakap pasal side effect, effect yang macam certain drugs, certain medication ni kan, kita biasa juga dengar macam G6PD contohnya. apa benda J6PD ni sebenarnya? Duk dengar J6PD, tak boleh kena ubat nyamuk lah, tak boleh sembarang-sembarang beli ubat lah. Pharmacist pun kadang-kadang tak berani nak bagi prescribe ubat kan. So apa cerita di sebalik J6PD ni?
Cerita ya, cerita
Cerita.
Ada cerita di sebalik dia. So J6PD deficiency ni ini penyakit bawaan genetik panggil, genetic disorder. Tapi janganlah fikir macam benda ni terlalu teruk sama ke apa, tak adalah. It's just one condition, cuma dia dibawa bawaan genetik. Kalau parents kita ada, kemungkinan kita ada risk untuk dapat jugalah. Nanti kita tengok the risk nanti. J6PD deficiency ni is a condition when body doesn't have enough enzyme, and this enzyme is called glucose 6-phosphate dehydrogenase J6PD. Gunanya J6PD ni, kenapa dia sangat penting? It helps red blood cells work and protect from free radicals that may harm the red blood cells. So kalau contohnya dalam gambar ni medication kan, ubat, ataupun ini fava beans, kacang parang. So kalau orang yang ada J6PD deficiency dan dia ambil setengah ubat dan kacang parang ni, J6PD enzyme, kalau dia kurang J6PD enzyme, ubat dengan kacang parang ni boleh meningkatkan penghasilan radikal bebas, dan enzim J6PD ni tak ada untuk nak protect sel darah merah. So kekurangan protection kepada sel darah merah menyebabkan sel darah merah tu cepat pecah. Dia fragile, dia cepat pecah, dan dia boleh menyebabkan hemolytic anemia. Maksudnya anemia tu kurang darah tu kenapa? Sebab darah tu pecah, hemolysis. So mungkin kita akan tengok orang yang ada hemolysis anemia ni dia akan jadi kuning. So jaundice lah, okay? Dia akan jadi kuning. So kerap ke ataupun ramai ke orang ada J6PD kat Malaysia ni? Macam tak dengar sangat je kan. Sebenarnya the prevalence in Malaysia kalau kalau dalam male punya population 4.6 in Malays, 6 in Chinese, 6% I mean, 1.3% in Indian, and kalau females 1.4% in Malay, 1.65 in Chinese, and 0.49 in Indian female. So kita tengok kenapa male lagi banyak kan daripada female. So sebenarnya dia adalah bawaan genetik. Contohnya kat sini kita ada ayah, kita ada mak. So dia ada dekat kromosom X. So ada sedikit variation dalam genetik pada kromosom X, dan kita tahu lelaki ada satu je kromosom X, dia ada X dan Y. Kalau perempuan ada X, double X. So nanti bila ayah ada carrier, pembawa gene yang ada di J6PD deficiency, dia lebih dilute lah. So anak perempuan kemungkinan akan jadi carrier. Kalau maknya ada carrier pada salah satu X, mungkin bila ada anak lelaki, mungkin salah seorang akan dapat J6PD deficiency. So lebih cenderung untuk anak lelaki untuk mendapat J6PD deficiency. So apa yang tak boleh makan ya sebenarnya? So kalau ubat anti malaria, so aspirin, sulfonamide, dapsone, nitrofurantoin, trimethoprim, sulfamethoxazole, inibatrim. So a list of medication ni you boleh Google je. Kalau anak you ada J6PD deficiency, you can just Google, and it's important for you to tell the pharmacist or the doctor that your child has J6PD deficiency, so that they would not prescribe this medication to your child. And kacang itik juga ya, tak boleh bagi dia makan kacang itik, jangan ajarlah. So and if you are breastfeeding a child that is J6PD deficient, kalau your child baby tu ada J6PD deficiency and you breastfeed, you pun tak boleh makan this ubat ataupun kacang parang. Okay.
Okay.
So jangan anggap benda kita lalu besar ke apa, it's just macam kalau kita prevent tak akan jadilah. So kalau jadi that jaundice it won't be fatal sebab dia boleh sembuh dengan sendiri. Okay.
Betul. So kalau ada anak yang G6PD deficiency ni, just take note, dan kalau dia tak makan semua tu tak ada masalah pun kan. Cuma kalau perlu pergi dapatkan ubat, maklumkan saja yang kita anak tu ada G6PD, ya. Okay. So I guess
right.
tadi just recap on the side effects tadi kan, just to let parents know that side effects yang penting, okay, yang perlu diambil tahu untuk kanak-kanak kurang daripada 2 tahun ialah masalah pernafasan, okay, respiratory distress kalau diberikan ubat selesema dan ubat batuk. Okay, jadi cuba elakkan untuk berikan dia ubat over the counter yang beli sendiri. Okay, pergi ke doktor untuk diberikan ubat yang bersesuaian untuk kanak-kanak berumur kurang daripada 2 tahun, ya. Please make sure that you take note of this. I guess that's about it from us. Tiger, back to you.
Thanks Dr. Haz and Dr. Zati for a fruitful discussion. So naturally it's pretty interesting to know a lot of things, particularly when it comes to medicating your kids, even though like I don't have my own kids, I mean. Okay. Okay, I have a few questions to ask. I think, some medications usually given in a capsule or in a tablet form, where the pharmacist or a doctor prescribe not to crush the tablets. So can you explain to us like why we shouldn't crush the tablets?
Well, maybe I can answer that, Liana.
Yeah, sure.
Yeah. There are certain formulation of medication in this term pills sahaja kan. We are asking about the pills.
Yep.
We also have different type of pills or tablet. We have the common one, or the basic one is the immediate release tablet. So this one, when it is consumed, it will be disintegrated and then it will hancur lah dalam badan kita kan. Secara rate yang the regular rate. Tapi ada juga formulation yang the scientists has already developed variation of formulation. Ada juga yang we need to protect that medication tu daripada acid dalam perut. So kalau that medication tu dia boleh disintegrate ataupun dia boleh jadi tak aktif kalau kena acid dalam perut, so we need to protect that drug tu. So the scientists reka this enteric coating pada the tablet tu, so that it will tahan the gastric acid dalam perut and then it will be disintegrated dekat intestine. Ada juga formulation yang kita nak the release tu slowly. Contohnya kita tak nak dia orang kena ambil 3 kali sehari, kita nak orang ambil sekali sehari saja. So kena releasekan slowly kan. So in that way the formulation scientist ni, mungkin pharmacist ke yang reka ni, they develop that formulation in a way that the drug tu when it comes to inside the body, it will be releasing the medication too slowly at the controlled rate. So that's why different formulation or different type of pill ni kita tak boleh pecahkan dia, tak boleh split. Kalau tak nanti kita mengganggu sistem tu sendirilah, sistem protection tu ataupun sistem control release tu sendiri. So anyway kalau at all times kena tanya dulu the pharmacist whether we can split or crush the tablet.
Okay. Well, thanks Dr. Zati. That's quite interesting to know. So it's a kind of reminder to all the young parents out there not to crush or split the tablets it's given to you. Okay, Dr. Hadzliana, you've been talking about this paracetamol syrup, right? So I have always a thing that running behind my mind. So the syrups and also the nasal delivery or oral, all these devices or packaging that comes with the drug medication, how are we supposed to dispose them? Is it okay like I just chuck away in a normal trash bin?
Okay,
share your thoughts,
yeah.
please.
Okay, so disposing medication safely, okay, we should be disposing them correctly by giving it back. Okay, we normally say, okay, if you get medications from the hospital, from the KK for example, if you have excess medication, bring them back okay, so that the pharmacy department can dispose of for you, because we don't want this medication to go into the our water supply, for example, if you just chuck it down the drain. Okay, however, okay, in the absence of take back program, for example, you cannot send the medication to the hospital. Okay, the FDA, okay, did say that the medication, especially like antibiotics, for example, the syrup, should be mixed with unpalatable substances, okay, such as coffee ground or perhaps kitty litter, yeah, and disposed in a sealed container into the trash. Okay, this is because you want to keep the medication from getting into the water supply, or tak sengaja orang lain makan. Okay, so there are two ways. So one is to give back to the pharmacy department, okay, for disposal, which actually will take up a lot of cost there. Okay, so if you are supposed to take the medication, please take the medication wisely. Okay, don't buy excessively. Don't stock up medication that you are not going to use. Okay, you kind of like, okay, I have 3 kids, I have to buy 3 paracetamol bottles, for example. Okay, so stock up in moderate, so that you do not have to dispose of medication, a lot of them, a lot of types of medication. Okay, so
Okay.
that's
Oh, thanks, Dr. Has. I think it's good to learn things from it, that we shouldn't dispose the waste from the medication as we want. So there's a proper way to do so. Okay, I have a last question. Actually, it's regarding the current COVID-19 pandemic. So as vaccination has become like one of the hot topic when it comes to the COVID-19 pandemic. So maybe like either one of you guys, can you guys share your thoughts? Is it safe to vaccinate a kid?
Okay, Tiger, that's a very interesting and tough, very tough question.
Yeah, I know it's a very hard question to answer.
Yeah. So maybe Liana can try later, but maybe I can share my thoughts.
deviate a bit from our main topic.
Yeah,
Okay.
about vaccine. Are we talking about COVID-19 vaccine or just general vaccine?
Maybe talk about the general vaccination to play safe.
General vaccination. Well, if you ask any pharmacies, I think most of them would say that vaccine is it has been tested, of course. Before it is being marketed, it has been tested thoroughly for the safety and the efficacy, and we have there are certain types of vaccine, like the live attenuated, or we have that vaccine, or it's just some components of that virus that is being included in that vaccine. But I must say that the benefit would be outweigh the risk if we're going to vaccinate our child, because the benefit of vaccination is way more than the risk. Of course, some percentage of child or might have these side effects or adverse effects from vaccination, but yeah, the benefit of the immunity that it will cover for the whole population, or those who will get sick, as compared to those who are those who are vaccinated too. It will protect the whole population actually, so we do not need to worry that much on that. But if you need clarification, or you need confirmation about the data related to that vaccine, of course you can always consult the pharmacists or the healthcare providers. They will be willing to help you to give more information on that. Okay, I think that's my thought.
In addition to that, quite recently, USM has a webinar on the vaccine development process. Okay, that was delivered by Prof. Dr. Norazmi Muhammad Noor, the Dean of the Health Sciences in USM. Okay, and he has mentioned it in a very lay term explanation, and it's very, very comprehensive and easily to understand. So you can go to the USM Facebook okay, USM Facebook, and search for the video. Okay, the recorded live videos for more information on the vaccine development. If it is a concern about what's in the vaccine, how safe it is, and apart from that, I think there are many programs that are on right now to educate parents, not only parents, even adults, about the safety and the need of vaccination. Not only just the hot stuff about COVID right now, but also the normal immunization schedule that the KKM has put in place.
Yeah, I think although it's in the COVID-19 pandemic, but I think we should not neglect to bring our child for normal or regular vaccination schedule. It needs to be continued. But
Yes.
yeah, you need to have a proper ikut guideline juga lah kan, kita wear mask when we go to the facility and keep our physical distancing and all.
Okay, good.
Yes.
Okay, thanks, Dr. Az and Dr. Zeti. I think we really had like a very interesting session with both of you. So I think for the audience out there, so thanks again for the audience for staying up with us. And then please don't forget to attempt the survey as in the comment box. And then hence we're wrapping up the Science Cafe for the year 2020. So counting our success and then failures, what we did, what we didn't, and where we are heading. So remember that no matter how hard the past is, and how can always begin again. So hence an advance Happy New Year, and then a Merry Christmas to the one who's celebrating. So here then thanks everyone. So see you guys in 2021. Bye.
Thank you. Bye.
Thanks, Tiger. Thanks, everyone.
Happy New Year.
Happy New Year. Almost.